There's a reason why doctors call it the silent killer. Pancreatic cancer often shows no symptoms until it's too late. But what if your body was already sending you signals, subtle cries for help that you simply missed? By the time most people are diagnosed, this deadly disease has already spread. But here's the truth. Early signs exist, and knowing them could save your life or the life of someone you love. Maybe you've been feeling a little off lately. A strange pain here, a little weight loss there. It's easy to brush it off. But today, we'll explore the 10 warning signs of pancreatic cancer that you should never ignore. This isn't just a list. We'll break down what each symptom really means, why it happens, and when it's time to take action. Don't skip a second. The final symptoms might surprise you the most. Watch until the end. One of these signs could be the warning you didn't know you needed. And please, share this with someone you care about. You might just save a life. Why pancreatic cancer is so dangerous. 1. It hides in plain sight. The pancreas sits deep inside your abdomen, behind the stomach. Because of this hidden location, tumors can grow for months, even years, without being noticed. You won't feel a lump. There's no simple blood test to catch it early. 2. Symptoms are vague and misleading. Early symptoms, like fatigue, indigestion, or mild pain, are easy to ignore. They mimic everyday issues, like stress, aging, or diet changes. That's why most people don't seek help until the cancer has already advanced. 3. It spreads fast and quietly. Unlike some cancers that grow slowly, pancreatic cancer is aggressive. It can quickly spread to the liver, lungs, or lymph nodes without causing obvious signs. Once it spreads, treatment becomes much harder, and survival rates drop dramatically. 4. Late detection equals low survival. Here's the hard truth. If caught early, the 5-year survival rate is around 37%. But if it's already spread, that drops to just 3%. And yet, early detection is possible if you know what to look for. 5. It doesn't discriminate. Pancreatic cancer doesn't care who you are. It can strike anyone, men, women, young adults, even people with no family history. That's why awareness is not optional. It's essential. 6. Knowledge equals power. The earlier you recognize the signs, the greater your chances. This video isn't meant to scare you. It's meant to equip you. Because when it comes to pancreatic cancer, early knowledge saves lives. Symptom number 1, unexplained weight loss. 1. When weight loss isn't a victory. Losing weight without trying might sound like a dream to some. But when it happens suddenly, and without a clear reason, it could be a red flag. Especially if you haven't changed your diet or exercise habits. 2. Why pancreatic cancer causes weight loss. The pancreas plays a key role in digestion. When cancer disrupts this process, your body stops absorbing nutrients properly. You may eat normally, but your body can't use the food to fuel itself. This leads to rapid weight loss, muscle breakdown, and weakness. 3. It's more than just the number on the scale. Unexplained weight loss often comes with other changes. Loss of appetite, fatigue, digestive issues. These signs together can point to something serious, possibly cancer. 4. When to take action. If you've lost more than 5% of your body weight in a short time, without trying, don't ignore it. That's more than 4 to 5 kilograms in 2 months for most people. Talk to your doctor. Ask questions. It might be nothing, or it might be everything. 5. Don't wait for other symptoms. Many people wait for more signs before seeing a doctor, but by then, it could be too late. Remember, sudden weight loss could be your first and only warning. Symptom number 2, jaundice, when your skin speaks for your body. 1. What is jaundice? A visible clue something's wrong. Have you ever noticed someone with yellow eyes or skin? That yellow tint is called jaundice, and it's often the body's way of saying, "Help me." It's not a disease itself, but a symptom of something deeper. 2. How pancreatic cancer triggers jaundice. The pancreas is located near the common bile duct. When a tumor forms in the head of the pancreas, it can press against this duct, blocking the flow of bile. Bile contains a yellow substance called bilirubin. If it can't drain properly, bilirubin builds up in the blood, turning your skin and eyes yellow. 3. What to look for. Signs beyond the yellow tint. Jaundice isn't just about skin color. It often comes with other signs, such as dark-colored urine, like tea or cola, pale or grayish stools, itchy skin, nausea or lightheadedness. These symptoms may seem unrelated, but together, they point to a deeper issue in your liver or pancreas. 4. When it appears, it's time to act fast. Unlike other symptoms that are easy to ignore, jaundice is visible and serious. It's not normal. It's not just aging. If you or someone you know shows signs of jaundice, don't wait. Get checked immediately. It could mean a tumor is already blocking vital pathways. 5. Jaundice is a red flag. Don't brush it off. Too often, people ignore jaundice until it's too late. But in the case of pancreatic cancer, jaundice might be one of the earliest signs you'll ever get. And it may be your only chance to catch the disease while it's still treatable. Symptom number 3. Abdominal or back pain. The pain you shouldn't ignore. 1. A common pain with an uncommon cause. Everyone experiences stomach or back pain at some point. It could be indigestion, muscle strain, or poor posture. But persistent, unexplained pain in these areas, especially if it's new, should never be ignored. 2. Where the pain starts and why. The pancreas lies deep in the abdomen, just in front of the spine. When a tumor grows in or near the tail of the pancreas, it can press against nearby nerves. That pressure often leads to dull, nagging pain in the upper abdomen or lower back. 3. How to recognize the warning signs. This isn't sharp or sudden pain, it's deep, aching, and persistent. You may feel it in the upper abdomen, in the middle of your back, especially near the shoulder blades, after eating, or even when lying down. And it doesn't go away with simple rest or medication. 4. Don't confuse it with everyday discomfort. What makes this pain different is how consistent and resistant it is. It doesn't respond well to common treatments because it's not a simple issue. If you've been treating it as a digestion problem or a back issue for weeks or months, it's time to dig deeper. 5. What this pain might be telling you. This kind of pain could be your body's early alarm bell. It may be signaling inflammation, pressure from a tumor, or even spread to nearby tissues. Don't wait for more symptoms to appear. Chronic abdominal or back pain deserves medical attention. 6. Trust your instincts. Get it checked. You know your body best. If something feels off, and it stays that way, listen to that voice inside. Pancreatic cancer is known for being silent, but sometimes it whispers through pain. Symptom number 4. Loss of appetite or feeling full quickly when a meal becomes too much. 1. Unexpected change at the table. You sit down hungry, but halfway through your meal, you feel stuffed. Or maybe you simply don't feel like eating at all. When food no longer appeals, without any diet or lifestyle change, that's a warning sign. 2. How pancreatic cancer disrupts hunger. A growing tumor can press on your stomach or release hormones that alter your appetite. Your digestive system slows down, making you feel full after just a few bites. Even your brain's hunger signals get mixed up. 3. Recognizing early satiety versus simple disinterest. Feeling full too quickly is different from simply not in the mood for dinner. Look for clues like eating half your normal portion and stopping suddenly, losing interest in foods you once loved, nausea or bloating within minutes of starting a meal. These aren't just picky eating. they can hint at something more serious. 4. Why you can't ignore it. Ignoring persistent appetite loss can lead to malnutrition, muscle loss, and fatigue. More importantly, it may delay the diagnosis of pancreatic cancer, where every week counts. Early satiety could be your body's cry for help. 5. What to do next. If you notice a sudden drop in appetite or feel full too fast, track it. Keep a simple food diary: what you eat, how much, and how you feel. Then share it with your doctor. This data can help uncover whether it's a minor issue or a serious warning sign. Symptom number 5. New-onset diabetes, when a diagnosis isn't what it seems. 1. The surprise diagnosis. Imagine being told you have diabetes, out of the blue, especially if you're not overweight, have no family history, and haven't changed your lifestyle. That sudden diagnosis can be more than just bad luck. 2. How pancreatic cancer upsets blood sugar. Your pancreas makes insulin, the hormone that controls blood sugar. A growing tumor can destroy or crowd out these insulin-producing cells. The result? Your body can't regulate glucose properly, triggering diabetes. 3. New-onset versus typical type 2. Most type 2 diabetes follows predictable patterns: weight gain, poor diet, genetics. But with pancreatic cancer, diabetes appears suddenly in someone without those risks. That's your first clue that something deeper may be happening. 4. Red flags in your lab results. If your blood sugar spikes without explanation, especially if your A1C rises quickly, ask questions. A rapid change in glucose control could be your pancreas struggling under stress from a tumor. 5. Acting on the warning. Don't settle for "we'll treat the diabetes." Insist on ruling out underlying causes, like pancreatic imaging or specialist referral. Early investigation can uncover hidden tumors when they're still small and treatable. Symptom number 6. Pale, greasy stools, when digestion turns disorderly. 1. What you're seeing in the bathroom. Noticing unusually light, or even clay-colored, stools? Or perhaps they seem oily, foul-smelling, and keep floating? These odd changes are more than gross. They're a flashing warning light. 2. Why stools go pale and greasy. Bile, produced by your liver and stored in the gallbladder, gives stools their normal brown color and helps digest fat. A pancreatic tumor pressing on the bile duct stops bile from reaching your intestines. Without bile, fats aren't absorbed and your stools turn pale, greasy, and malodorous. 3. Spotting the difference. Normal versus concerning. Healthy stools are firm, brown, and sink in water. If yours are light or clay-colored, floating on water, coated in oil, or have an especially bad odor, it's time to pay attention. 4. The hidden consequences. When fat isn't absorbed, you lose out on vital nutrients and calories, leading to weight loss, vitamin deficiencies, and constant bloating. Ignoring these signs can accelerate malnutrition and mask an advancing tumor. 5. Taking action. What to do next. Keep track. Note how often and how your stools look and feel. Share this information with your doctor. It can guide blood tests, imaging, or referrals to a gastroenterologist. Early recognition of pale, greasy stools may uncover a bile obstruction and the underlying pancreatic tumor, while it's still manageable. Symptom number 7. Fatigue, when tiredness runs deeper. 1. Beyond normal tiredness. We all feel tired after a long day. But persistent exhaustion, the kind that doesn't improve with sleep, can be a red flag. It's more than just busy life. 2. How pancreatic cancer steals your energy. Cancer cells are ravenous. They hijack nutrients and energy from your body, leaving you drained. At the same time, disrupted digestion and inflammation reduce the fuel your muscles and organs need. 3. Spotting warning signs. Look for clues like waking up still exhausted, needing frequent naps just to function, losing interest in hobbies or social activities. If fatigue dominates your day, even simple tasks feel impossible. It's time to take notice. 4. The ripple effect. Severe fatigue impacts every part of life: work, relationships, even your mental health. Ignoring it can delay diagnosis and allow the disease to progress unchecked. 5. What you can do. Track your energy levels. Note when you crash, how long it lasts, and any accompanying symptoms. Share this log with your doctor. Early investigation into unexplained fatigue could uncover pancreatic issues before they escalate. Symptom number 8. Back pain, when pain signals something deeper. 1. A common complaint with a hidden cause. Back pain is one of the most frequent reasons people visit their doctor. But persistent, unexplained back pain, especially in the mid or upper back, can be more than muscle strain. 2. Why pancreatic tumors hurt your back. Your pancreas sits just in front of your spine. A growing tumor in the pancreas can press on nearby nerves or tissues, sending pain signals straight to your back. 3. How to tell it's more serious. Watch for these warning signs. Pain that radiates from your abdomen into your back. Discomfort that lasts for weeks, not days. Pain unaffected by rest, heat, or over-the-counter painkillers. Worse when lying down or after meals. 4. Don't write it off as just back pain. If you've treated your back pain like a typical ache, massage, heat, rest, but it never fully goes away, it's time to dig deeper. 5. Next steps for relief and answers. Tell your doctor about the location, intensity, and timing of your pain. Ask if imaging, like an ultrasound or CT scan, might be needed. Early investigation could reveal a tumor before it spreads. Symptom number 9. Nausea and vomiting, when your stomach rebels. 1. More than just motion sickness. We all feel nauseous sometimes, after a rough ride or a spicy meal. But persistent nausea and vomiting, especially without an obvious cause, can signal something serious. 2. How pancreatic cancer disrupts digestion. A tumor in the pancreas can press on or invade the stomach and small intestine. That blockage slows or stops food from passing through, triggering queasiness and forceful vomiting. 3. Recognizing warning patterns. Ask yourself, do you feel nauseous within minutes of eating? Are you vomiting even small portions? Is the vomiting persistent, multiple times a day or night? These clues hint at a blockage, not just an upset stomach. 4. Why ignoring it can be dangerous. Beyond discomfort, ongoing vomiting leads to dehydration, electrolyte imbalances, and rapid weight loss. More importantly, it can delay the discovery of a growing tumor, narrowing your treatment window. 5. Immediate steps to take. Keep a simple log. Record what you eat, when nausea starts, and how often you vomit. Share this with your physician. They may recommend imaging, like an ultrasound or CT scan, to check for any obstruction in your digestive tract. Symptom number 10. Blood clots, when your veins send a warning. 1. Unexpected clots in unlikely places. Deep vein thrombosis, or DVT, can show up as swelling, pain, or redness in your leg. A clot in the lung, PE, brings sudden shortness of breath or chest pain. These aren't just random luck. They can be your body screaming for help. 2. How pancreatic cancer raises clot risk. Pancreatic tumors release proteins that make your blood more likely to clot. At the same time, they can compress vessels and slow blood flow, both breeding grounds for dangerous clots. 3. Spotting the danger signs. Watch for unexplained swelling or pain in one leg, warmth or redness over a vein, shortness of breath or rapid heartbeat, sharp chest pain that worsens with deep breaths. If you notice any of these, act fast. 4. Why clots can be your earliest alarm. In some people, a clot is the very first clue of pancreatic cancer, sometimes months before other symptoms appear. Ignoring it isn't an option. Every hour counts. 5. What to do immediately. If you suspect a DVT or PE, seek emergency care. Doctors will use imaging, like Doppler ultrasound or CT pulmonary angiography, to confirm. And don't forget, once you're stable, mention your overall health. A clot plus other subtle signs could point toward pancreatic screening. Today, you learned the 10 subtle warning signs of pancreatic cancer, signs that could whisper, "Pay attention." Armed with this knowledge, you're now one step closer to catching a silent threat before it strikes. Imagine the relief of early detection for you or someone you love. It only takes one moment of awareness to change a life. Don't let these signs go unheard. If this video opened your eyes, hit that like button. It helps more people find this vital information. Then subscribe and ring the bell so you never miss our weekly health deep dives. Which symptom surprised you the most? Drop your thoughts below. We read every comment. And if you have a story to share, you might inspire someone else to seek help sooner. Next week, we'll uncover 5 foods that secretly support pancreatic health and how to include them in your diet. You won't want to miss it. Thanks for watching. Stay vigilant, stay informed, and stay healthy. See you in the next video.